In Health Watch this afternoon, a drug used to treat long-term addiction claims to work in just one day.
Also getting the word about flu shots. KCAL9's Health Watch reporter Dilva Henry has this.
That's right, very important. Well, if you've ever had severe aches and pains, chances are you've taken a painkiller, maybe Vicodin, codeine, or OxyContin. Besides easing the pain, they can give a feeling of euphoria, a high, and that can be addictive. But a new treatment claims to cure addiction in one day. If you've ever had long-term pain from a neck or backache, or maybe an illness, you're not alone.
We have an estimated 60 to 70 million Americans who are in pain at this time.
Dr. Rick Chavez is medical director of the Pain Institute in Torrance. He says people in pain are usually prescribed painkillers that are morphine derivatives.
People are familiar with hydrocodone derivatives like Vicodin, Lortab, Norco. And then we have OxyContin and morphine derivatives, Oromorph. And then a newer drug that has been used a lot is fentanyl, which is a patch and comes in sucker form also.
Most people do use the medication correctly, the right dose for the right amount of time, but that's not always the case.
They did a household survey in 1999, and more than 9 million Americans admitted to using doctor-prescribed medications inappropriately.
And that can lead to addiction.
Some people have been on 30 to 50 Vicodin a day.
Problem is, if too much of the medication is taken for too long, the painkillers can mask the actual pain.
We can't tell what is worse, the pain of their original problem or the pain actually that the narcotic causes. As you know, if you're on a large number of narcotic analgesics, you actually go through withdrawal multiple times during the day, every 4 to 6 hours.
People in this cycle may want to stop, but often can't.
We're talking about people like you and I, policemen, school teachers, CEOs of companies, college students.
There's an FDA-approved drug to treat the addiction with few side effects, and it's getting rave reviews. It's called Buprenorphine, sold under the brand names Suboxone and SUBUTEX.
They do attach to the morphine receptor in the brain. Now, what that does is it displaces the other narcotic analgesics that the patient is addicted to, and it allows them to withdraw off of their drug without going through a lot of the symptoms of withdrawal.
What time frame are we talking about?
Couple days.
That's remarkable.
It's amazing. This is an amazing drug.
Some people say even one day is all they need. For more information on this treatment, you can call 310-798-1633. Again, that number, 310-798-1633. Dr. Chavez says only in LA certified to use this drug are prescribing it. Not nearly enough, he says, since it's about 80% effective. Tomorrow we'll hear from two people who say they were cured of their addiction using this treatment. Really amazing.
That is very amazing.
Mild side effects, so certainly something to look into if you or someone you know has this problem. Well, after being addicted to painkillers for a decade, one man says he was cured in a day. And it's the same story for other patients, thanks to the medication SUBUTEX. Melinda Adams suffered from health problems that left her in pain and took her down a path she never imagined.
They started me out with Vicodin, and then that didn't last, and so then they upped it to, they actually tried a couple other OxyContin.
Soon she needed more.
And within 2 hours of taking a dose, I was already starting to go through the withdrawals.
And want more of the medication.
And want more of the medication. I had gotten up to, I want to say 18 a day. It was horrid. It was bad temper and just I'd break out in sweats all over, and it just was constant.
Same story for this man who wants to remain anonymous. 7 surgeries from a skiing accident and martial arts left him in constant pain.
I was taking the Vicodin, Soma, and the anti-inflammatories as well, all in one day. So it would be 25 pills a day.
He would get new prescriptions from new doctors, but after a 10-year cycle of addiction, he had enough.
It's everyday people, and they get caught in a cycle, and it's just horrible.
They both turned to Dr. Rick Chavez, director of the Pain Institute.
We have this huge population of people who are addicted or dependent on these doctor-prescribed narcotic analgesics.
To help patients, Dr. Chavez uses the medication SUBUTEX, FDA approved to treat addiction.
It was literally this is when you're getting off of it, and in 12 hours you're starting the buprenorphine, and that was it. It was a piece of cake.
It was wonderful. It made a profound change in everything.
It's hard to hear the word addiction because I'm like, I'm not addicted, you know, but I was.
Melinda knows admitting that helps her and hopefully others.
There's nothing you'd be ashamed of.
For more information on this treatment, you can call area code 310-798-1633. Again, that number 310-798-1633. Dr. Chavez says only a few doctors in LA are using this treatment. Not nearly enough, he says, since it's about 80% effective. Pretty amazing treatment here. Got to make the decision to do it, though. If you know someone or you affected by this, certainly at least think about getting help.
Yeah.
Okay, and also thank you to both of the patients. They were just wonderful to share their stories with us.
Suboxone sublingual film administration instructions. Suboxone film is a combination of buprenorphine and naloxone indicated for maintenance treatment of opioid dependence. It is a sublingual medication, which means that it is absorbed through the veins under the tongue. Before taking Suboxone film, drink some water to moisten your mouth. This will help Suboxone films dissolve more easily. To open your medication package, fold along the dotted line and tear down at the slit, or use scissors to cut along the arrow. Making sure your hands are dry, use 2 fingers, grasp the outside edge of the Suboxone film, and remove it from the package. If your dose is 1 Suboxone film, place it under your tongue, close to the base on the right or left side. If you are directed to use 2 Suboxone films, place the other Suboxone film under your tongue on the opposite side. Try to avoid having the Suboxone films touch as much as possible. Keep the Suboxone films in place until they are completely dissolved. If you are directed to use a 3rd Suboxone film, place it under your tongue on either side after the first 2 have dissolved. While Suboxone films are dissolving, don't chew, swallow, or drink water because they will not work as well. Make sure your friends and family are aware that you shouldn't talk when the Suboxone films are dissolving, because this can interfere with how it is absorbed. Always take Suboxone film exactly as prescribed by your doctor. Important safety information. Suboxone